Welcome to Voices of Nursing with Dr. Nozell, Care, Policy, and Leadership. This episode highlights a nurse leader firsthand experience traveling to Washington, D.C. Advocacy Day to engage legislators on critical health issues. Conversation. Welcome, Dr. Syke, to the show.
Thank you, Dr. Noziel. It is a pleasure to finally be in Voices in Nursing with Dr. Noziel. Congratulations on your new podcast. I'm looking forward to our time together.
Thank you. Dr. Sykes, can you introduce yourself?
Okay, well, I am a registered nurse for more than 25 years of experience across diverse healthcare settings. I've held multiple roles in leadership and management throughout my career. Currently, I serve full time in academia as a doctoral lecturer at the City University of New York. I am passionate about teaching, educating. So,
Have you worked bedside?
I started working at the bedside
Which
first.
one?
Yes, I was in med-surg in New York, and then I've also worked in California. I've always been in school as much as I can remember, from the bachelor's to the master's, to the doctorate. So yeah, I've worked
Mhm.
various roles throughout my nursing journey.
What motivate you to travel to Washington, D.C. for Advocacy Day, and why advocacy is important to you as a nurse?
Well, as nurses, we are advocates. Advocacy is really integrated in nursing, taking part in advocacy in DC. Actually started as a student nurse. So since then, I've been going every now and then, every opportunity I get. So this is part like an extension of who we are. Yes. So,
I can see while you're in Washington, D.C. advocating,
mhm,
in your state advocating for the patients.
yes,
How was
definitely.
that?
It's always very rewarding because we meet nurses throughout the state. Uh, to act, we have different nursing organizations that met together as well. So the
Mhm.
latest one was that we did in early February was held by the National Black Nurses Association.
Yeah.
So we had nurses throughout the state. And that's like a reunion. That's always welcoming, and it's time for
Mhm.
networking, and we're all there for the same cause. So it's usually very invigorating. Yes.
That's right. What does an advocacy day typically involve?
An advocacy day, usually you get prepared. It's something that we prepared ahead of time. So we had like different meetings to prepare what it entails, the prompts, how, we're going to approach the policies that we want to portray, we want to talk about. It's usually we have in our group, there's a lot of health inequity that we talk about. So we plan ahead of time exactly which policies will be discussed, and then what usually we usually tell we have a session in the morning, we get ready,
Mhm.
and then everyone knows that who they're going to go visit. They're going to go to their state legislators, and then following that preliminary session, we all just scatter and go to the capital to meet our state legislators. So it's planned ahead of time, the prompts are planned, and so on and so forth, so we can have a successful day.
Yeah. Were the legislators nice?
Yes,
Responsive?
they were very engaged for the most part. Sometimes we may not have met them personally, but sometimes we meet their staff, which is equally good because the staff can report our concerns to them. But for the most part, they're very engaged, very receptive. They love to have nurses so they can hear our stories, they can hear exactly our concerns and hopefully work on it, do something about it.
Yeah. And from my experience in Advocacy Day, most of the time we meet with different senators. They'll come in and listen and talk with us a little bit. It's kind of fun.
Yes. Mhm.
What health issues did you and your colleague bring to the legislators this year?
This year, we usually always just had to do with health inequity. But this year, we talked about the nursing not being viewed as a as a profession.
Mhm.
Because, as you know, the Department of Education had removed the nursing as a profession. That's going to cause an issue with nurses who actually wants to pursue higher education.
Yeah,
So,
I agree.
yes, nurses who wants to pursue higher education, like in nurse practitioner, as an educator, researcher, so they're not going to help them with loans. So, which is an issue because that's going to halt nursing, nurses pursuing higher education, and in turn, that's not going to help the shortage that we
Mhm.
have been dealing with for such a long time. It's just going to get worse. Yes.
3 weeks ago, I was on a radio show talking about my live experience. Someone called and asked, well, since the nursing, they're going to recategorize nursing as not being a profession, is it a good time to go to school now for nursing if it's not a profession? I
Yeah.
tell them, absolutely, yes, nursing is a profession. And I gave her example of how many years I've spent in school, starting from CNA to be having my PhD, advocating for patients and being care for my patients. Nursing, it is a great profession. It's fulfilling. I would say self gratifications for me being a nurse. So I tell her definitely it goes. We nurses stand up to make sure that we boost the profession to the right path. And that would also help us improve the healthcare systems because we already have so many shortages. We want to improve it, not terrorizing it. Okay.
Correct. I'm glad you were
So,
able to redirect
huh?
her. I said, I'm happy that you were able to redirect that
Yes,
caller because
yes.
it's important that they don't hear those things and kind of, stop pursuing their dream of becoming
Mhm.
nurses because the nursing profession has been through a lot. And I'm sure that this shall pass.
So, how did the legislators respond to hearing directly from nurses about patient care?
Yeah, they were very engaging, very welcoming, So we did see a couple of senators, but unfortunately, we could not see everyone we had in mind. We had to kind of separate ourselves because everyone had one an appointment at 1 o'clock, others at 11 o'clock. We were able to see most of the representative in our state of New York. So that was productive. The one that I met personally were very engaging. They always very happy to see nurses and hear directly from us,
Mhm.
exactly in our own words, our own stories, what's really happening. I don't know if you may have heard that New York State had a very large strike that
Mhm.
lasted about 6 weeks. Nurses were on strike in New York for a long time. That was good. They actually heard stories why those nurses were on strike. One of the reasons was that the staffing issue. So there was low staffing and patient ratios that she experienced like a patient fall that could have been fatal just because they were low on staff. So when they hear that directly from nurses, I think it makes more sense to them. It's more tangible. I'm hopeful that that made like a difference.
Were you able to bring issues on Black maternal health?
Well, I know that was one of our concerns, but unfortunately, we had to prioritize.
Oh,
This year, I think the nursing as a profession was more heated and the staffing issue for New York State. Because being that, we were on strike in New York for like 6 weeks and Advocacy Day was happening at the same time, we kind of concentrate on one or two that's more pressing. And then that's what we did. It was nursing as a profession and it was the staffing issue. Hopefully, when we go to our local state, because we are scheduled to go, I think next month in March,
mhm.
just for New York State in Albany. So maybe at that time we would probably go ahead and address maternal mortality as well, because it is dear to our heart as well.
Oh, right. But we have so many issues.
Many issues.
But was there a moment during your meeting that really stood out or reinforced the importance of nurses' voice in policy?
Yeah,
Yeah.
I think the moment was when one of my colleague, just told the legislators exactly, how someone could have died, someone
Mhm,
fell and could have died just because we didn't have enough staff. So that was a moment when I've noticed that he paused and kind of processed it. And actually, probably maybe that's when he did see the importance of having like enough staff to take
mhm,
care of patients, because that actually interfere with quality of service, and put patient at risk. And we definitely do not want that. I think that was one moment that I felt that, okay, maybe this just resonated with this legislator. That was a moment for me.
was okay.
My clinical experience definitely shaped my advocacy commitment, because I've lived it. I've lived it all. As I mentioned earlier, I did work at the bedside.
Mhm,
Then I worked in a different organization, in management, in leadership. I kind of see it all, so I know what it entails. When you're ready to advocate, you can actually use personal stories, that things that you've lived. That actually definitely shaped the way I advocate. And when I go to these advocacy days, I'm pretty much be very, what can I say? It's coming from my heart. It's
mhm,
the experiences that I've lived. I can tell tons of stories, when I go there. I remember last year we talked about suicide. That was a moment for me, because when I did mention suicide to one of the legislators at the time, I knew at least three individuals within that same year
mhm,
that actually killed themselves. So at that time, I was even moved, emotional, when
mhm.
I was telling them how important suicide was to us as nurses.
Yeah.
Yeah,
Oh boy.
yeah.
Um, what misconception do policymakers often have about nursing or healthcare that you're
Well, I think some misconceptions that they may have, they think, oh, nursing is bedside. It's just bedside, it's clinical. Some people may think that they have no business with at that level advocacy,
Mhm,
but then again, that they fail to understand that nurses, we hold different hats. We're not just at the bedside. We're like leaders. We do so much, so, and we see so much, so we are well placed to be advocates. We are well placed to actually go there and then explain things the way it is. You know, they have misconception that we have no business talking about advocacy, because it's
yeah.
clinical, it's
And
patient care.
sometimes it's just like insensitive stuff or things that we have to do.
Correct.
We know sometimes
Mhm.
I will go and get my patient. The doctor will call you about the patient. The family member will call you about patients.
Mhm.
The charge nurse will call you about your patient. The physical therapy will call you. The respiratory therapist will call you. The nutritionist will call you. The
Mhm.
pharmacy will call you, the nurse. Everybody is calling you about the nurse. And everybody have the chart. Everybody has everything. But guess what? They call you.
Mhm.
And then calling you, it's calling you is because you're the one that knows the patient well.
Mhm.
And you the one as a nurse that the patient's communicating with you.
Right. Yeah.
They like everything, they're like vulnerable to you and very open to the nurse. And I will say with that type of work that we do, we are underpaid.
Yeah.
But since many nurses doing it with love and especially with advocacy, there's no money on advocacy. If there's money on it, let me know because I have zero, not even a penny on advocacy. This podcast, it's advocacy to share with the viewer, to educate people in the community, to a space where anybody, elected official, doctors, nurses, anybody's on healthcare, family member, anybody comes to this show and share the lived experience. And then where other people can learn, we can learn from each other. As I tell people, we don't give medical advice. But we do share our personal experience, and it's advocacy. And
Definitely. I truly
and it's
commend you.
also time consuming.
Letting people know about what's really happening and letting people hear the voices and what goes on. So
Mhm.
that is great initiatives, and I applaud you for starting.
What advice would you give to a nurse who feel intimidating by policy to ensure where to start?
Well, I think the advice I would say is just that you've already advocating for your patients. Every nurse is, as long as you become a nurse and you are working as a nurse, you already advocating for your patients. So there's no reason to be intimidated, because you're doing it already. Just you need to communicate now with a different body. You're going to communicate with legislators, and it's not just what I'm referring to advocacy day, but just now you just mentioned that even this podcast right now is advocating. So it's
Mhm.
something that we do on a regular basis. As long as you can communicate clearly, then you advocate. Some people may be uncomfortable talking to legislators, but it's something that the more you do it, the more comfortable you get to
And
do
I
it.
would say knowledge is power. And if institutions start adding advocacy on their curriculum, they can start on fundamental first semesters of nursing school of classes
Right.
for people who are already at the bedside, graduated from nursing. They can start with the UPC, Unit Practice Console, and advocate for patients.
Right.
And so we can make improvement for better care, better outcomes for patients, and so we can have like a safer place for our family and friends and people in the community.
Some school do have that added to their curriculum. I'm currently teaching leadership and management right now, and that is one of my focus. So
Mhm.
I often make sure I tell students how important it is to advocate, not just for your patients, but also at the national level on policies and so on and so forth. But yes, I would definitely encourage all nursing school to introduce this at the undergraduate level. Yeah.
Yeah. What does making an impact through advocacy mean to you?
It means everything to me. It means the world to me because, like you said, since we have been nurses for quite a while, so I think the obligation falls on us to go out there and tell it like it is. Because once you've been a nurse like me for over 25 years, you've seen a lot. I've worked in different facilities and I've seen so much happening. And I've seen all the inconsistencies. I've seen all the concerns, all the problems. So I feel like I'm obligated to advocating for patients. We also to continue to do it because we do it not for individual patients. We do it for communities. We do it for populations. And so it's who I am now, is who I've become because I think it's part of my training as a nurse and I've embraced it. So yes, it means a lot to me.
Yeah, especially with healthcare system, the way we see that it's going, and then what we have learned during COVID about the healthcare system, the healthcare disparities, that is very huge. A lot of people was surprised, and I was watching. news, some people were devastated about it. I wasn't surprised because I know it was there, working as the bedside and seeing things that happen. It's almost become a norm. I know it's not a norm. I've always an advocate, but not to that level that I am now seeking for advocacy. When things not right, I say it's not right.
Mhm.
I speak out. The more I've learned about advocacy, I've said, "Oh my God, I was doing it. I just probably don't know what I
Correct.
was doing."
Correct.
And I've learned from my colleagues that was already far ahead of me about advocacy. They'll tell me that advocacy 101 is you get involved, you stand up, and you speak up.
Yes.
That's through this podcast. And then that's what I am encouraging our healthcare providers, our nurses to stand up, show up, and speak up. And then they have to support local. And if they cannot travel, they just pair with a colleague, somebody, and show concern and then support. And then I want more nurses. I would like to see more nurses involved in healthcare advocacy and started to run for office because when they look at it, if somebody's on healthcare, knows about healthcare. I want to see more healthcare providers, more nurses, more doctors involved in policy, involved in advocacy.
Yes, Dr. Nozier, it was a pleasure. I would love to be part of this again.
All right.
Thank you for having me.
All right. And if you are listening to us now, I would love for you to comment, share, subscribe, and like. And also let me know what topic would you like me to show. Thank you.
Thank you.